Hi, and welcome to tonight's free session on natural remedies for pain. My name is Martin Stone from Switch On Health, and tonight is the third of 4 free sessions that we're running this week as a part of Natural Medicine Week, ATMS Natural Medicine Week 2020. This session is being recorded live and it will be up on YouTube later. If you are watching this on YouTube and you'd like to help support us in our mission to make natural health available for everybody, please just click on that subscribe button, because the more subscribers we have, the more we can offer. And we look forward to offering you more. Now, if you're watching this live tonight, welcome. If you do have any questions as we're going through, please feel free just to type them into the chat box and we'll be able to answer your questions at the end. If you're watching this on YouTube and you've got any questions, just pop them into the comments down below and we will be sure to get back to you. Our presenter for tonight is naturopath and homeopath Sally Maisie. Now, Sally has got years of experience as a practitioner, and she is also one of the course writers and tutors here at Switch On Health. And those of you who have got Sally as your teacher, you will know just how passionate and dedicated Sally is to turning you into the best practitioner that you can possibly be. So without further ado, I'll hand over to Sally.
Awesome. Thanks, Martin. Hello, everyone. I hope you're all doing well in these rather strange times we find ourselves in. This is the first one we've sort of had since COVID struck, I think. Today, though, we're going to talk about pain. And obviously with pain is very individual. It is one of the most individual things that you could garnish from a patient. It is something that is of your own perception. It is something that you have grown up with. It is something that varies from person to person. So what we're going to do today is we're going to go through a few things that I've used in the past with patients, and we're going to go through a few things that you may not have considered when becoming a practitioner, when dealing with a patient, how you need to ask them some good questions. So let's move on. We've all experienced pain at varying degrees, I am sure, but here are just some sort of little pictures of pain. But we've also experienced different pain types as well. And the reason why I've put labour at the beginning is I wanted to talk about it briefly because it's a bit of a misnomer, really. Labour should be an ecstatic experience. In fact, it should be an orgasmic experience. If you are releasing lots of oxytocin, which I'm sure some of you have heard of, a good feel-good hormone, then your cervix is going to dilate. But if you are releasing cortisol because your mum told you that labour was painful, or your grandmother told your mother, and then it was passed on through generations, you know, we've got to sort of change that a little. I won't harp on about it because I'll be on my soapbox and I don't have time. The other thing that we need to consider when we're looking at some of these pain types is anything ending in an algia, an A-L-I, an A-L-G-I-A. Algia basically means pain. So you've got their neuralgia. So that's going to be sort of nerve pain. Preferably they feel it in their face. Fibromyalgia, I'm sure you've heard of. If you see something that ends in an itis, that means it's got inflammation. Now, inflammation, whether it be first, second, or third stage, each one of those stages has a certain amount of pain involved. So inflammation is a form of pain, but it is an immune response to the body saying, oh, hold on a minute, there's something going wrong, okay? So we then look at things like sprains and strains, and, you know, even you can see there I've put in a stubbed toe. We've all stubbed our toe, and I'm sure we've all sworn. Some of us may have even broken our toes when we've stubbed our toe. And we've all had a paper cut, and some of those also can be somewhat painful. Here is approximately 80 odd, nearly 90 words to describe pain. Now, I have this as a A4 laminated sheet to show my patients so that I'm not putting words into their mouth, so that when they're describing their pain, because a lot of people don't know how to describe pain, they can then look at some of these and go, yeah, well, it is like a drilling feeling, or it is like this pang that I get. So that's then telling me, well, okay, is it muscular? Is it nerve? Is it, sort of, what can I give them then? So by them describing their pain to me, which is vital, I mean, absolutely vital. If you can get your pain and itches, two things that people just can't explain very well. So if you can get your patient to start to realize different types of pains, then they're going to start to know their body better. I've had students in the past where they've been able to, and myself included, I've been able to tell you what ovary is dropping an egg because there's a little twinge. So that's how well you need to know about pain. So just a few. And on the opposite side to that A4 piece of paper, I've got 90 or so words on emotions. So my patient can then describe the emotions that they're feeling around this pain. Because some people will just say, I'm just sick of this pain. Or this pain is just, it's been with me all my life. So it becomes like a big brother to them. It becomes like their whoopee cushion, their cushion or their little toy that they play with as kids, that becomes, they don't know who they are without their pain. So pain's a really individual thing, and if you can be a great practitioner and take away a patient's pain, you will be excessively busy. But with that pain comes also a mental health aspect, and we'll go into that a little later. But let's have a look at how we have to consider pain. So what we want to do is we want to reduce the pain. We want to relieve the pain. We want to sort of maintain healthy body. We want to maintain healthy nerve function. And thus what will happen then is that we will then feel no pain. Now, nutrients that we're going to go through later on, when we give someone a nutrient, we've got to consider, is this magnesium sulfate, which could give them the runs, or is this magnesium phosphate, which could then, absorb better into their gut? So I've put here some chelates, some phosphates, some biglycinates. These tend to absorb better in the gut, because again, we don't want to do any harm as practitioners. We've got to consider, is this a chronic condition that has acute pain involved, such as arthritis or Crohn's perhaps? Or is this just a straight acute, I've gone running and I've pulled a muscle or I've strained a muscle? I talked about inflammation before, and inflammation is really important to have an understanding of. And there's three main phases to inflammation. First one being, redness, swelling, pain, and it's all to do with the discharges as well, whether it's clear or albuminous or yellow. So it's important to understand where they're at in their inflammatory process. And then asking the patient, well, tell me what you're feeling. Tell me what you're sensing. What does it feel like, sensing like? So it's really important to have good questions when you're taking a case around pain. It's important to sort of know, when did the pain start? Because they might have, if you think about it from a metaphysical perspective, they might have lower back pain, and that could mean that they've got financial woes if you think about it metaphysically. So it's really important, the questions you ask, the more information you get, the non-prompting questions that you give, and that just makes you a much better pracky. We then got to consider how we're going to give the product to our patients. Do we give them capsules? If so, it's got to make sure it's got an enteric coating so that it gets to the gut and absorbs properly. Do we give them drops under their tongue? I'm a homeopath, so I'm all about sublingual sort of, doses, and thus it gets in quicker and can alleviate quicker. Consider powders sometimes being more gentler on the gut. Don't just consider that you need to have capsules and drops and it's always got to be internal. You can do internal with external at the same time. So topical creams and ointments could be in order And as a homeopath, you've got to consider whether you want to have a wet dose or a dry dose. And that's really important as well. So let's move on to some of the types of things that you can use. So I talked about this before. Mental health obviously has a big component to pain as well. You know, if you think of fibromyalgia, if you're stressed, then your fibromyalgia may flare up. If you've got Crohn's, your Crohn's pain may flare up because you might be under stress, you might be anxious, you might be depressed. So here are some of the neurotransmitters that are really important to have an understanding of. And with GABA and 5-HTP, you can actually get them in practitioner-only products. But you've got to be careful that you don't interact with some of the other drugs that your patients may be on as well. So just be aware of that. So let's just go through a few. GABA, first of all, it's a brain chemical. You know, it's mediating. It regulates the transmission and the perception of pain. So it tells you how intense your pain is. Is that paper cut going to cause tears? Is that paper cut going to go on for an hour? Or is that paper cut just, it's a paper cut, yeah? Dopamine, it assists in reducing chronic pain. So it's known as the pleasure hormone. And it's linked with that sort of reward center in your brain. So when you're doing great things and you're having a great time, you're less likely to think of pain. You know, it's really interesting when people are having a great time and having fun, their pain goes away, no matter how chronic it tends to be. If you ask your patient, when does it feel relieved, or when do you not notice it? They'll often say it's when I'm having fun, or when I don't have any worries, etc. So like I said, mental health plays a huge role. Pain and mental health go hand in hand, I believe. 5-HTP, you know, it's a precursor to serotonin. I'm sure we've all heard of all of these. And it's one of the feel-good chemicals. So it starts as tryptophan. And there's been some really good studies to show that 5-HTP can actually reduce fibromyalgia pain, along with a certain herbs and certain really good protocols. You know, if you are a member of any of the suppliers, they all have magnificent pain regimes and pain protocols, because as pracies, we want to reduce people's pain because we don't want them having Panadol or paracetamol or, you know, Nurofen, ibuprofen, because what they do is they suppress the pain. It's called a painkiller for a reason. So what we do as natural therapists is try to alleviate all of that through what we can give them that allows the body to assess that pain in its own way. And then noradrenaline there, you can see that hormone, it's said to inhibit neuropathic pain. So, you know, any sort of nerving type pains. So they're your neurotransmitters. As I said, GABA, 5-HTP. It only used to be that you could only buy it in Queensland, 5-HTP. I don't know whether they've changed the rules. I'd have to find that out for you. And I'm sure Martin can post to that to let you guys know. When we look at diet type foods, though, some of the things that we need to look at when we think about muscles is gelatin. This is where your bone broths come in. That beautiful layer of jelly that you get on top of your bone broth or your chicken stock. You know, I've seen people in the past throw it away and I'm going, what are you doing? Oh, it's just fat. No, it's not. The fat is the white stuff. Sure, get rid of that. It's cloudy, it's grey, it's bubbly, it's ick. But this gelatin is this beautiful, clear, jelly-like substance that helps strengthen collagen. And it just makes you feel great because it's getting into all that connective tissue. So bone broth's not only good for the immune system, but good for your overall health, and especially to reduce pain sometimes. Medicinal mushrooms, I'm sure we've all heard about them. The Japanese varieties in particular. You can get some really good practitioner-only products that contain those mushrooms. And again, you know, because inflammation is an immune response, you're also assisting the immune system. You may have heard of quercetin and bromelain, a couple of antioxidants, but they're also anti-inflammatories. You know, grapes, berries, cherries, bananas. You know, have a smoothie in the morning and then have your bone broth soup, and you're having a great day. You know, your pineapples, your kiwi fruits, your fermented foods, so your kimchis, your sauerkrauts, etc. All of those things are really good in helping to reduce inflammation and reduce thus pain. You can see there's some tryptophan foods. One of the best sort of tryptophan foods that I know of is walnuts. You know, imagine a banana walnut smoothie with some almond milk. The almond milk's going to help with your mental health, and that's going to help reduce some pain. You're starting off the day beautifully. So brain food's important. Your whole grains, your eggs, your nuts, your berries. Make sure it's wild salmon, not farm salmon. You know, you've got your good omegas, etc. Some of that dark chocolate. Now it's 1 to 2 little cubes, not a whole chocolate bar. All right, just putting it out there. I know I've got to poo-hoo it. Sorry about that. Green tea, beautiful for its antioxidants. Yeah, beautiful to get rid of some of those free radicals that can also induce inflammation. We then move on to nutritional supplements. So the first one, the biggest one of all, magnesium, magnesium, magnesium. We don't get enough of it. Get it through food, get it through a supplement if necessary. If you're not sleeping well, then that's true too. But when I think of magnesium, I think of the person is getting cramps. The key word for magnesium is cramping. They'll say, oh, I've got this cramping pain. So it's good for dysmenorrhea, or it's good for, I get a cramp in the belly, or I get a cramp, you know, in my muscles, etc. Glutamine works with magnesium beautifully. It produces glutamate, which reduces pain amplification. I'll say that slowly. And it helps with the central nervous system sensations, so that you're not hypersensitive potentially. Yeah. The greatest one of all, EPA, DHA, it's our omega-3s, your fish oils, your flax seeds, your chia seeds. But if you are in pain, then you do need a practitioner-only dose. Unfortunately, I don't think that the dietary recs are going to do it. The dietary recs are there for maintenance and prevention, whereas these supplements are there for therapeutic use. So the reason why I've put EPA, DHA, it reduces that inflammatory response, thus relieving pain, as it says. But I've put a measurement here of up to 2,400 milligrams per day. I think it's one of the most essential sort of pain relievers, especially for the EPA for joint pain, you know, the arthritic sort of pains, the gouty type pains, the you know, carpal tunnel-y type things. DHA, great for brain health. So that's going to potentially reduce some of the neuropathic pains, so the neurological pains, the nerve pains. There's a combination called glucosamine, MSM, and chondroitin sulfate. Now, chondroitin sulfate and MSM we make in our own bodies naturally, but sometimes we don't make enough. And that's used to help with things like osteoarthritis. Now, you can get that in a set lot. You can get that from most, you know, good health food stores. But the biggest buzz this year, or last year really, it's been around for a fair while, but all of a sudden everybody's, you know, it's one of the buzz ones, is PEA. So palmitoyl lethanolamide, or palmidrol. Yeah, that's the chemical breakdown of it. It is for chronic pain. It is for acute pain flare-ups. Yeah. In a prescription for patients, I'd be inclined to do EPA, DHA. I'd be inclined to do PEA, and I'd be inclined to do curcumin, you know, and just start them off with something simple like that. And then look at well, I'm not a herbalist, so I don't really look at herbs. I've done some herbs for you, but I'm not really a herbalist. But those 3 things would be 3 nutritional supplements that I'd consider for my patients that had a lot of pain. You can see there that with the PEA, it contains these endocannabinoids. So it has this opioid sensation to it. It reduces sort of tissue damage, and it acts as this anti-inflammatory and thus, you know, a neuroprotective. And again, I've put a prescription there of up to 1,200 milligrams a day, depending on your patient. Now, you have to make those calls for them though, because they can't do it themselves. But there's some of the nutritional supplements. And then and Martin will tell you this, I'm a devotee of the Blackmore's Celloids. There's there's 11 celloids, and if they're in my ashes, because that's how they were found, in the ashes of dead people, if they're in my ashes once I've died, I think they're pretty important. I think they're pretty vital for good health. And the ones that I've used with great success are these combinations. The first one is potassium phosphate and magnesium phosphate, and that's for really acute pain. My husband, although I love him dearly, is nearly 60 and would play AFL football if he could every week. Unfortunately, with COVID, that's not possible, and we're travelling around Australia, so he can't join a team. But when we were in a stable household, he would go every week to play footy, and he'd use PPMP and another product that I'll talk about later, week in, week out, and his mates would say, how come you keep backing up, Tone? You know, you're doing really well. I'm feeling no pain. You know, what are you doing? So the whole team ended up on PPMP and this Zen oil, which I'll talk about later on. CPMP, though, is more for children. So if I'm thinking about children that have pains, then I'm thinking about the CPMP. So that's calcium phosphate and magnesium phosphate. And that's for growing pains. And that's for little people who, you know, they say to you, you say to them, where does it hurt? And they say, oh, I've got a headache. And then they point to their belly. So this one's just a really gentle one that's going to help them through any sort of little niggly pains that they may be experiencing. PCIP, well, that's my go-to. It should be in every household's first aid cupboard across the world, I believe. And that's a big bloody call. But PCIP is potassium chloride and iron phosphate. And it is first and second stage inflammation. And it just reduces things beautifully, reduces the inflammation beautifully. As you can see here, I've done an acute dose. So you can have one tablet of these every 15 minutes for up to 2 hours and then drop it back to 2 hours, or you can continue to, you could, oh, look, I'll make the call. You can choose these like lollies, and all you're going to do is wee out what your body does not need. Yeah. Now, I know that these are lactose-based, so if you're going to chew them like lollies, then they could be a bit difficult for some of those lactose intolerant. But I have used them on lactose intolerant patients though. So think about that as well. BioResearch. Now, BioResearch is a practitioner-only company that does homeopathic complexes. So they're a polypharmacy. They are multiple remedies in one remedy. Okay. So I've just put a few here. First one is PAS, so it's an antispasmodic for dysmenorrhea. There's a UT, which is to reduce, this one's a really good one for gout, to get rid of kidney waste. And JNT is for joint inflammation. So you can then research, you can certainly go onto all these websites and research all these products and look at what's been put into these products. But you will find that the reason why I use sometimes the homeopathic complexes, even though I'm a classically trained homeopath, is because for ease of compliance, the biggest thing with your patients is compliance. 50% of patients don't comply to any sort of thing that you may give them, more often or not. And that's throughout, whether it be conventional medicine or natural medicine. So we've got to give them something that they're going to comply with. So rather than me give them 54 remedies or a dozen supplements, why not just give them one bottle and see how they go? That's just my theory to it. Less expense to the hip pocket as well for them as well. And they'll keep coming back. Moving on to the homeopathics, my true love, my true love. I've only put a few here. There's certainly many. Again, with the homeopathics, like I can give you an example of a woman who, she was an acupuncturist. She had a severe migraine and had this severe migraine since she was about the age of 7. And she came to me when she was in her 40s. She was really concerned because she was having up to 8 to 10 Panadol or you know, analgesics, conventional analgesics a day, and she was really concerned about it, so she wanted to change. And after taking her case, and I mean diligently taking her case as a classical homeopath, it came up that phosphorus was what that she was after. And I gave her this phosphorus, only in a 30C, so it was in a higher to mid-range dose. I gave her 3 doses of it. So a night dose, a morning dose, and another night dose. And I waited, and I said to her, look, I'll call you in a couple of days, which I did, and heard nothing. 5 days later, still hadn't heard anything. I thought, oh, goodness me, I think I might have killed this person. You know, it was in my early days. And I'm thinking, oh, God, what do I do? 7 days later, she rang me. And it gives me great joy because she had the worst, and I mean the worst ever headache she'd ever had in her entire life. For the first 3 days of taking that single homeopathic, and by the end of the 3 days, her headache was gone. That was over 10 years ago. She gets an occasional headache. She's still in touch with me. I get a little Christmas, you know, wishes from her every year. And that gives me great joy because I was able to take away pain. And that's magic to me. So here are some of the first aid homeopathics. And the first one is hypericum. Some of you may know of it as St. John's wort, but it's as a homeopath, we call it hypericum. And it's specifically for nerve pain, okay? So any of those sort of real lightning twinges, you know, that sort of thing where you, oh, you know, oh goodness me, it's really painful, and it feels like someone's just stabbed me with a lightning rod, yeah. So it's good for those sort of really nerve type tension headaches, you know, or those really twingy type headaches, or even the sinusitis that can feel a bit twingy. Magphos, magnesium phosphate, there it is again. You know, magnesium, magnesium, magnesium. It's the 3rd time I've mentioned magnesium, so you can't go wrong with magnesium. But again, here's that cramps. These people feel better when they're holding on to maybe their belly and they're bending over double. You know, that gives them some relief. Arnica, I'm sure you've all heard of arnica, bruising, you know, any sort of bruising. But these people don't like to be touched, and they will send you away saying, you know, they may have a fractured skull, they may have been in a car accident, they're in shock, and they'll go, no, 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 don't worry about me. Go look after the person over there. They're worse off than me. And that person might be walking around with no problems. So that's a real arnica type thing. Their bed feels too hard. That's how delicate and sensitive they are to touch. Rustox, a great one. Bryonia, a great one. Those 2 are my go-tos for any sports injuries, you know. They're the sprains and strains guys. But the key to those 2 sprains and strains remedies is one is worse for movement and one is better for movement. So the Rustox is better for movement. They've got to get up, they're moving around, they're restless, you know. Oh, it's my sciatica and it's twinging and, you know, it's moving around. I've got to keep moving. The Bryonias, though, is don't touch me, don't make me move. I can't move. Oh, my God. It's just the worst thing ever. Yeah? They're your Bryonias. Dry bry. They're also really dry. Okay, and then the last one there in the homeopathics is the root de grave, and root de grave is pain down to the bone. They'll feel it, you know. I've just recently, in October, some of you may have seen my previous webinars, but in October I broke my arm, and I crushed my my radius, and my ulnar is now longer than my radius, and the doctors wanted to do surgery on it. And it was my right hand. Now, I have full capacity of my right hand. I occasionally get a twinge, which I'll put a little bit of arnica cream on it, or I'll take some bryonia. I'll be fine. I can feel a little bit of inflammation every so often. And the only thing I can't do is quite successfully wipe my bum. But apart from that, I didn't need surgery. And the pain is negligible, when the doctors said it would be excruciating. So just be aware, all right? Potencies with the homeopathics, if they're little people, so children, animals, you feel that they're in pain, go a 6C and a 12C, especially if it's really acute and really physical. But for a lot of adults, there's a little bit of mental health going on, some mental emotional stuff going on at the same time. Go with the 30s, 200C, 1Ms. Now we're in a subject that I'm really not too au fait about, so this is why I've written so much about it, because I'm not a herbalist. But the boswellia is magic with turmeric together. It's for pain, joint tenderness, anti-inflammatory. Again, I've put another prescription here because, as I said before, the three things that you need to consider: EPA, DHA, the PEA, and then the curcumin. Start off simple, yeah? So 360 milligrams a day of bioavailable curcumin. You know, although your dried turmeric it might be organic and you put it in your curries, that's going to help. It's not therapeutic, okay? There's another beautiful one here, quite sort of more traditional Chinese, is cinnamon and red sage. It's a sort of warming combo. It moves blood around. So therefore it can be really good for dysmenorrhea. So, you know, painful periods. For anybody who says to me that painful periods are the norm for them, painful periods are not normal. They are common, but they are not in any way, shape or form normal. You know, I was fortunate enough to be a woman who, teenage, little bit of angst, you know, menopause, little bit of angst, but in between, nothing, no pain, no nothing. So it is not normal. So please try and get all your female patients to understand that. California poppy, well, it's the opioids. It activates that GABA. Corydalis works on your dopamine, serotonin, noradrenaline. Jamaican dogwood, love it. It's a great one. And it's an anodyne. So it is just specifically for pain, spasmodic pain, you know, those real sort of throbbings, yeah? And then there's a few other little ones here. Cramp bark, well, it's in the name, eh? White willow bark, also a good one for dysmenorrhea. And I put in cyprium bark because that's a really good one for soothing gut pain. But so too are oats, porridge, beautiful, yeah? Here are some of my topicals. As you can see, it's in my first aid cupboard. It's in my first aid cupboard. It's in my first aid cupboard. I have a husband who is accident prone, so I need to have these products in my first aid cupboard. Physio cream, arnica, hypericum, calendula. We've got Zen oil. Zen oil has arnica, boswellia. Here we are again, some magnesium creams, electrodes, really good. Tramiel is a homeopathic cream. And then the good old fashioned tiger balm, we've all had it. You know, I've been having it since I was a kid. Tramiel and Zen oil. Let me tell you a little bit about those two. Tramiel, better for when cold applications relieves the pain. Zen oil, better for when hot applications relieve the pain. In my clinic, I give my patient, if they tell me they've got pain, I say, is it better or worse for hot or cold? And I have a little thing that lives in my freezer and another one that I can put in a microwave, a little wheat bag. And if they don't know, then I'll go heat it up or I'll go and get it out of the freezer. I'll put it on their hand or wherever they're feeling the pain. And then while I'm taking their case, they can tell me what feels better. Yeah. It's all about being active with your patients. Here are some of the practitioner-only products for pain. I give you all of them because I am not one for saying that one is better than another. So by concepts, Inflame Aid tells you what it does. They've got a pre-GABA, Metagenics, Pain X. They've got a headache relief, which is a homeopathic, right? You've got some more bio-research ones there for throbbing and for acidic pains. You've got TheraActive, which is a curcumin bioavailable. You've got your EPA, DHA. Make sure you get a good one. Yeah, if you're going to do this for pain relief, it's got to be a good one. You've got your PEA powders, but they also come in drops. And Neurodol by Biomedica is a homeopathic for pain and fever in children. And it's very effective. I've used it often. To finish off with, we've got to consider the metaphysical side of things, guys. You may have heard of Louise L. Hay. She believes that pain is because of guilt. And guilt always seeks a punishment. So when you're guilty, you know, you're emotionally and mentally feeling some guilt, so something's going to manifest physically. So here's a little affirmation for you. I lovingly release the past. They are free and I am free. All is well in my heart now. In the Barometer of the Soul, Annette Noontal, these are two great books that I have in my clinic all the time. not being good to yourself, giving yourself a hard time. You're going against what your soul's telling you to do. Like whenever I think of somebody with a headache, they're not listening to their heart. Yeah. So their head is giving them pain because they're not listening to their heart. So Annette says you're going against your soul's plan. Disease does not bring pain. The pain of your soul brings dis-ease. Pain is good because it gives you an idea that you need to look at what's going on in your life. So I often ask my patients, what happened 24 hours before this pain started? Did you have a fight with your husband, etc., etc.? That's my webinar for today, guys. I hope you enjoyed it. Martin, over to you.
Excellent. Thank you, Sally. Now, those of you that have been to Sally's sessions before know that she loves to pack it in, so much so that we run out of questions. Now, we do have a second session set up for questions. Please just have a look in the chat box. If you're not sure where this is, just put your mouse down at the bottom of the screen and you'll see a little thing called chat. Now, when you look in the chat box, I have put a meeting ID in there. We are open for questions. So in about 90 seconds, this session is going to end, whether we like it or not. And we're going to have a new session. I like to call it the after party. You know, this is like the VIP room that we all go into afterwards, you know. So look in the chat box. If you've got a pen and paper, the meeting ID, if you've got a pen and paper, quickly grab it now and I'll tell you. The meeting ID is 719 1544 9585. So I'll say that again, or just look in the chat box. You know, if you're not an auditory person, if you're a visual person, it's in the chat box. If you've got a pen and paper, 719 1544 9585. And we've got about 60 seconds left. I can see we've got one or two questions here. A couple of people are saying thank you, and absolutely, Sally, fantastic presentation. We've got a couple more positive messages coming through. Thank you, thank you, thank you. Lots of great messages. Thank you, everybody. Please do join us for our questions and answers. If you'd like to have a chat with myself and Sally, please do jump into this other session that we've got set up. We'd love to have a chat with you, and we can also open the microphone and video for you if you want to have a chat with us.
There's a couple of questions there, Martin. Just quickly, yes, I can send you the PowerPoint. That's all right. That's no problem. And Martin can post it wherever he can. Liquid magnesium. Yeah, you can do liquid magnesium drops. Hannah, you asked. Yeah, just as effective. Sublingual is excellent. Yeah.